I got a story for you. Can't seem to get rid of those last 10 pounds I know I gained.
Who's trying? I'm going to start trying today.
So many carbs over this week. Anyway, you may want to think about liposuction. This particular procedure only takes an hour. It's really hard watching yourself decompose. I really had bags under my eyes, and it was bugging me.
Marilyn Kent, best known as half of the comedy duo, the Mommies, wanted a change, and liposuction was the answer.
I had a bit of an eye job where he sucked out all the fat of my eye. Well, he lifted it out, actually.
So what would you do if I said, hey, doctor, do whatever needs to be done, carte blanche, money is no object, recovery time is no object, what would you do on that?
Right. All I do is a love handle. This is about a 1-hour procedure. And again, this I really feel should be done under local anesthesia.
Welcome back. Before we went to the break, we told you that one of us got plastic surgery last Friday. Now, let's see if you can guess which one of us got it and what we had done.
Okay,
you want to go to the audience?
You're still handsome. You still look 30. I don't know. All right, let's go with this lovely young lady right here. Yes, ma'am. Hi.
I don't know. I think Mario got his dimples enhanced because there's no way you could be that adorable, you know?
They can't get any deeper than that.
Yes, ma'am. Stand up.
I think it was you, actually.
You think did I have plastic surgery? Because I look so much better today?
You look a little more trim in certain areas.
Really? All right, well, thank you very much. I know this lady had a comment about men in plastic surgery. Would you stand up for me, please? What did you have to say on men in plastic?
I have an eerie story because I had a friend who had an allergic reaction to some kind of food, and he blew up, and he wanted to have liposuction. And I thought that
he
was
blew
just
up permanently?
Yeah, no, I mean, like, he gained excessive weight. I mean, really, it was disgusting.
Well, what did you think about having liposuction?
It was just gross.
You think a man who would have liposuction is gross?
Yeah. So
Danny, come sit down here. Let us reveal this now. Can we have a drum roll or something like that? Will the real person who had the plastic surgery please stand up?
Very good. Very nice.
Now, Danny, after the ladies in the audience agreed that it was gross.
Right. I was very happy about that.
What'd you have done, bud?
I'm about 4 inches taller. No, I had liposuction is what I had done. I had my love handle. What happened was I've been working out with you for a while. I lost a bunch of weight, and there was nothing I could do. There didn't seem to be an exercise or cardio or anything that would get rid of my love handles. I got a good friend who's a plastic surgeon. I called him up and I said, will you get rid of these things for me? Boom. It was like Jiffy Lube, man. I was gone in an hour.
Really?
Yeah, it was amazing.
Then, with that apropos introduction, let us bring out the surgeon who performed Danny's lipo from Spalding Drive Cosmetic Surgery and Dermatology. Please welcome Dr. David Amron.
Dr. David in the city. In the city.
Hey, doctor.
Okay, what are you doing, buddy, over here?
How you doing, doctor?
First of all, let me tell you how good of a plastic surgeon is. He's 75 years old.
Wow. All right, doctor, what does lipo involve?
Well, lipo is really, you are sucking out fat with instruments, but over the years, the technique has gotten better and better.
I have a question, doctor. Now, is it true, I don't know if this is just a silly rumor, but say you suck it out of this area, right? Is it true that those cells are now dead? You'll never gain weight there again, but if you do gain weight, it could be like bulgy in other places?
Well, not bulgy, but one of the common misperceptions is that the fat comes back, and really whatever you remove is removed. It doesn't come back in that area if it's done properly. And about it going to other areas, it's all about, as far as I'm concerned, where you're out of proportion. So it's targeting those stubborn areas and making you in proportion.
That's why the love handle
if he behaves himself, which
is unlikely.
Right. I mean, you mean to tell me these love handles won't come back?
They shouldn't come back, absolutely.
Wow, that's amazing. Now, did he need, come on, Danny didn't look like he needed
He's a
any
board-certified
lipo.
plastic surgeon. He's not going to perform surgery I didn't need, although I did have to talk him into it. No, but it was a very small procedure. You know what's funny about this is the doctor said, you can go back to work the very next day, and I disagree with you. You can go back to work the same day. I felt nothing. I was numb that day and a little discomfort after that.
Let us take a moment and look at you before the surgery.
Okay, this is my favorite clip. Watch this.
Oh, yeah, there's your big old fat guy. You're exaggerating.
Yes,
You're
I am.
sticking it out on purpose. But I can see that little bulge in the back.
See the back?
Yeah.
Oh, you guys suck.
Oh.
What was that move? move.
You did the jiggly thing. What
It was a joke. I didn't know they'd show it. And it's so over between us. You're dead to me.
It's like a bowl full of Jello without the bowl.
Oh my God!
But I will tell you, diet next time, I got down to my goal weight. That was the thing. A lot of people have a misconception. Tell me if I'm wrong, Doc. That it's for real big people. I had dieted down to my goal weight and then still had the love handles. That's why I had it done.
Right.
Can we take a look at the clip?
Yeah, we got a video of him, I believe.
Of Dr. Amron in action.
Well, let's check it out.
All right, this should be gross.
All right, so what I'm doing now is I'm marking out the areas that we're going to be doing liposuction on. And in Danny's case, it's just fine-tuning these flanks, these love handles over here, getting to bring them in a little bit and get a little bit of better definition in his lower waist area. I mean, he's in pretty good shape, but this fullness over here in the flanks, the love handles. And so probably, when you got pants on, it bulges over even more, right?
Yeah, I know. The needles that I got to make it not hurt, which I was terrified of, that he said, well, this is going to hurt a little bit, didn't. So far, nothing has hurt. Well, I love you more than anything. I'll talk to you later, sweetheart. Wait, I want to sound like a doctor. I got to go. I'm in surgery.
Danny, we're done.
Painless. It's an hour later. I'm on my way out the door. You got a problem spot? I highly recommend this. See ya.
Doctor. Okay, wait a minute. Obviously, Danny wasn't in pain. He's making phone calls, talking to his wife, the whole bit, cracking jokes. Look, oh my God, it was so. You look like you were sawing him in half with that thing.
What I want to ask you about is what was that?
Yeah, that's suction.
That is
sucked out of my body.
Oh, God.
So, was it like an epidural or from the waist down you numbed?
No, it's all under local. So you put the local in there to help break things up, reduces the bleeding, and then you start the liposuction after. So he's not feeling anything during it.
I couldn't believe it.
And the funny part was, like I said, I could have gone back to work that day because I felt nothing till the next day, and it was just like you said, uncomfortable. No real pain would be an exaggeration.
It looked like you were getting your teeth cleaned.
Doctor, thank you very, very much for giving me back to us.
Thanks, Doc.
man. Hey, I want to thank my good buddy, Dr. Amron. Stick around. We got lots of surprises for you.
Meet Maureen, student by day, Budweiser model by night. Cosmetic surgery fans 24/7.
I'm here to get liposuction done. I'm getting it done on my inner and outer thighs. I'm doing it basically for the purpose of my job, which is working as a promotions model for Budweiser. I've been doing the promotion model thing for about 6 years now. So I'm getting older, and they're coming in younger and younger. And as we get older, it's not as easy to maintain.
Okay, we're going to now do the marking.
This isn't Maureen's first trip to the OR. Like many models, actresses, and rock stars, she had her breasts done. And you know the old adage, once the boobs go up, the hips must come down.
I can expect these to be gone, baby. After 30 years, finally they're out.
We are ready to rock and roll. Well, liposuction is really what it sounds like. You really are sucking out fat.
You work it out.
Now, people ask what the fat looks like, and I would say the closest looking fat is chicken fat. It's not about just being overweight. It's about targeting stubborn areas of fat.
You work it out.
A lot of my patients are models and actors who keep in great shape, who are very lean in many areas, but have some stubborn, one or two stubborn spots. Have you been able to get rid of these things with diet and exercise?
No, I did Tybo for 3 years straight, 5 days a week, and it's still...
Oh, my God.
The hips went down a little, but the saddlebags never went away.
People, again, say this is a quick fix, and it really is.
It's a little too easy. It's kind of scary.
You work it out. An hour and a half and 1.2 liters of fat later, and voila!
Check it out now.
Maureen sunk saddlebags.
Well, now this is the new me. We got my new dress. Fitting a little better than it used to. You got the right side.
Check it out now.
Left side. The back is a little trimmer.
Check it out now.
And I'm looking better.
Maureen may be happy now, but is there more cosmetic surgery in her future?
I'm always open for the opportunity of getting more work done. Actually, I'm thinking about redoing my breast augmentation because they're starting to look a little too natural. Maybe just a little bit bigger.